My patient was a 59-year-old Caucasian female who was admitted to the hospital on April 4th due to a closed femur fracture of the left leg. She is on a regular diet. The same day she had surgery on her left femur ORIF. I am now. Reason being she fell off the boat dock getting baptized. Some subjective data from her. She said, I am in 10 out of 10 pain and want some pain medication. She also said, I was a nurse at the VA on the med-surg floor, then worked for Bayada. This pain is unbearable. She also said, I can't tolerate this pain any longer whenever she was doing physical therapy. Some objective data would be her potassium was 4.7, hemoglobin was 8.9, hemocritic was 28.5, white blood cell was 10.4, sodium was 131, MCV was 99, red blood cells was 2.87, BUN was 15, and glucose was 1. Findings I found from patients. When I first walked into the patient's room, she was laying in her bed watching TV. I walked out and she already asked the CNA to ask the nurse for pain medication, so I went back in the room with my nurse, and the patient was alert and oriented times 4. She was in 10 out of 10 pain from her surgery. She didn't eat much breakfast. She only ate like 5%, which was her cereal. She was very anxious and worried about receiving her medications because she was only wanting her pain pill at that moment. But we gave her patient education on how her other medications would help her with her health. Some priority problems would be absence of falls, knowledge of self-care, fall prevention, risk of infection, impaired skin integrity, appropriate nutrition intake. Patient's needs. The patient will ask for help when wanting to transfer from bed to wheelchair. Patient will eat 50 to 70% of meals. Patient will maintain a proper hygiene. Patient will keep surgical incision clean, dry, and intact. And patient will understand the need to clean surgical incision to decrease infection. Intervention needs. The nurse will promote safety. The nurse will have the call bell within reach for patient. The nurse will educate client on the importance of self-care to prevent future health problems. The nurse will educate the client on proper hygiene, nutrition, hydration to help with skin integrity, and then the nurse will evaluate and ask about pain level of the patient. Everyone's emotions. My nurse Lynn was very rushed and busy the whole shift. I only saw her when I was giving medication earlier in the morning. Even if I needed to ask her a question about my patient, she was open and was willing to talk to me about them. My patient was very anxious, fearful, and nervous about having her surgery and pain from it. She didn't like the fact moving in the bed. The nursing students were very willing and helpful on the floor when tasks were needed. Responses and changes to the plan. My patient was very open about her education and occupation of being a nurse. She was very nervous, anxious, and had bad anxiety. She didn't want anyone to touch her affected side of her leg because of her muscles would have a spasm and she would yell. Changes I would have made is patient education of range of motion on the affected leg so the muscle and joint wouldn't be stiff and in as much pain by using mobility. Other changes could have been informing her to use her incident spirometer to help with her breathing. Skills performed. I did administer medications, perform a head-to-toe assessment, hung normal saline antibiotics, prime tubing, and elevated affected leg with putting pill underneath the knee for support. Effective communication. The nurses give effective communication from the handoff report for each individual patient. Then my nurse sat me down and went over all the medications. My medical diagnosis and what happened that she was admitted. The patient was very quiet on the floor today. The nursing students were busy doing head-to-toe assessments and administering medications. Differences in the plans is that I could have had more patient interaction, be more confident in helping patient out with putting socks on the affected side because I was nervous, but performed the skill well. But she screamed when I put the sock on because she had a muscle spasm. Other difference I could have made was reposition my patient in the bed better, trying to help her and trying to get her to transition from the bed to the chair. Pros for my skill performance: I use therapeutic communication, provided foot care, perform head-to-toe assessment, and administer medications and indication and use for different types. Cons: more patient interaction, and patient education on how range of motion and exercise of affected leg will help to decrease pain and increase mobility. Overall performance: I thought my day on HUA was busy, fun, and informative. The day was cut short, but I got all of my skills performed for the patient that I was assigned to. I was very confident in giving medications with my nurse instead of my instructor. Today was very effective on the floor. I was very effective on the floor with helping with tasks and building trust with my patient.